Hi, my name's Tanya Williams, Chief of Everything at Digital Conversations, and we're here at Digital Strategy Summit 2015. And I am here with Stephen Parrish, who is the Executive Director of Information and Infrastructure, as well as CIO at Mater Health. Did I get the title right?
You got it right.
I got the title
perfect.
Right. It was a long one. Mm-hmm. So let's talk more about what types of new digital technology you guys are implementing within the hospitals, because you've got a number of hospitals across the state. Love to hear more about what you're sort of doing.
Sure. So, healthcare traditionally is quite challenging when it comes to technology. We have a lot of data but very poor information. So a lot of the things that we're doing is around trying to make sense of the data we capture. So the things we already capture, but also the things that we need to capture to make our services more efficient and effective and provide better outcomes for the patients. So the sort of things we're doing is around, scarily, we're looking at tracking our nurses and our doctors, not necessarily to see what they're doing, but when they go into a room, traditionally they would press a button to announce that they're in the room. Then when they go out, they press it to come out. They often forget or get busy, and so you look down the corridor and there's 5 or 10 lights on, and there's no one in those rooms. So by having them tracked, that means that when they go into the room, the light comes on automatically. When they come out, it turns off automatically, and you know exactly where someone is at any point in time. It also helps for emergency situations. If you're looking for the closest nurse to deal with a code, like a patient might be having some trouble. Also means that when they do call the nurse call button, you can actually see who's there or who's around and make the most appropriate person go and answer that. So that's one technology. There's a lot of things we look at. Unfortunately, with healthcare, everything's expensive, and as a not-for-profit, we sort of weigh it up and determine the best way of doing it. So along with that is equipment tracking, mother-baby matching, so making sure that you have the right baby with the right mother.
That's pretty important.
Yeah, it is. And unfortunately, have been incidents, not necessarily with us, but in organisations where the wrong baby's been given to the wrong mother, where the wrong milk's been given to the wrong baby. So there's the whole milk matching to the child, mother-baby matching. So there's a whole lot of technologies that can be used, and we're looking at them to see what is innovative and useful in our organisation.
And it sounds like a lot of that's around where you can create efficiencies using that technology within, like internally.
Oh, definitely. We do a lot of work around. Everything we do is around making sure that we benefit the patient, but give the clinical staff more opportunity to be more efficient and effective at what they do with the use of technology. You've got to remember, technology is an enabler. It's just a tool. It's not an outcome. So you have to work out the outcome and find the right tool through technology.
Not just for the sake of technology.
Correct.
Yes. Okay. So you guys have got a lot of hospitals and business units with so many different locations. What's the biggest challenge for you guys with this digital and technology and innovation? It's
really just data, and people say big data. I don't refer to big data. I think we've always had the data. We just haven't used it well. We don't necessarily capture more. We just capture it differently. Like we capture more electronically now than we have on paper. But within our organisation, we're still a very paper-based organisation. So we have a lot of systems, so 130 systems that hold clinical information. So the challenge is, how does a clinician know where to get it? They can't go to 130 systems to get it. So we've developed portals that bring it all together, a summary of that data together. We've got patient portals where patients have access to their information and their data. We've got doctor portals for external access. We've got internal portals which allow a summary of that information to be provided. But really it comes down to, how do we make that data available at the point of care so they can make the right decision at the right time for the right outcome?
And it sounds like you guys are really looking at it from a holistic point of view, so it's not just the customer-facing communication and channels, it's all like obviously what you're doing internally and communication with staff and all your stakeholders, and which is a holistic approach.
And we try. The challenge with healthcare, it's probably with any large organisation, is there's not one good mechanism of communicating with people. So you might send an email out, but not everyone will actually have an email account, or they might have an account but never actually use it. And so you have to find multiple mechanisms to deliver the same information, and that's a big challenge.
And people want to communicate in different ways as well.
Definitely.
So some people want to communicate via digital channels, and others, I imagine, are very traditional based, and it's all about getting hard copies of things and that sort of thing. So that creates its own challenges.
Yes, and the average age of, say, a nurse in Australia is 48. So they're not necessarily technology comfortable.
Yeah.
Doesn't mean that they don't know how to use it, they just choose not to or just don't want to.
Yeah.
And we've got the Gen X and Ys coming through. They want technology, they demand technology, a bit more savvy, they expect it. And as a traditional healthcare organisation, we're challenged with that and trying to keep it so that technology is available for anyone that wants to use it in the way they want to use it.
Big challenge. So where do you see the biggest growth potential for innovation and technology over the next few years for Mater Health?
Sure, it has to be data. It has to be use of data to turn into valuable information. That's key. Whether it's using what we've got or putting in more systems to enable us to use it better, that's the future. We're looking at electronic medical records, so similar to what Harvey Bay Hospital have done previously. We've selected a vendor, we're just going through what it means to do it, what's the cost, what's the value and the benefit to the organisation. It's a big investment to do that, but that's just one component of a strategy to move forward.
And I imagine there's some long lead times with some of the stuff that you guys are looking at now and when would actually probably likely to be implemented.
We're looking 5 years' time. So the actual project is a 3-year project implementing EMR. That covers all aspects of the business. So it's not just clinical staff that impacted, it's admin staff, it's all the back of house areas that impacted as well. So it's not a large cost from a technology perspective, but it's a big change management cost to the organisation.
And I suppose a bit of a change in mindset for all stakeholders who are involved as well as to how they utilise some of this technology.
Definitely.
Thank you very much for taking some time to have a chat. I think this stuff is really fascinating, and I think there's been a lot of discussion over the last couple of days around data's certainly been one thing that has continually just keep coming up, and the change of mindset. And I think what you guys are doing, the fact that you are looking at new ways and better ways to use technology, not for the sake of technology, but use it in ways that are relevant. I think there's going to be a lot of eyes on you guys in the industry to see, how you're doing that moving forward.
It's all about trial and error, isn't it? And that's what medicine's about. So hopefully we don't error.
I hope so as well. Awesome. Okay. Thank you so much for your time.
You're welcome.
Thanks.